We stay with news from here in South Africa, where the government has announced an end to COVID-19 restrictions with effect from midnight tonight. President Cyril Ramaphosa made the announcement in the capital, Pretoria, a short while ago. He says the country has been recording a steady decline in both new infections and COVID-19 related deaths, but has cautioned citizens to remain vigilant as the pandemic is very unpredictable.
While the pandemic is not over, and while the virus remains amongst us, these conditions no longer require that we remain in a national state of disaster. Going forward, the pandemic will be managed in terms of the National Health Act. The draft health regulations have been published for public comment. Once the period for public comment closes on the 16th of April 2022, and the comments have been considered, the new regulations will be finalized and promulgated. Since the requirement for a national state of disaster to be declared in terms of the Disaster Management Act are no longer met, Cabinet has decided to terminate the national state of disaster with effect from midnight tonight. The Disaster Management Act provides that certain elements of the regulations may remain in place for a limited period for post-disaster recovery and rehabilitation. Accordingly, certain transitional provisions will remain in place for a period of 30 days after the termination of the national state of disaster to ensure essential public health precautions and other necessary services are not interrupted while the new regulations in terms of the National Health Act come into effect. What this means is that all regulations and directions made in terms of the Disaster Management Act following the declaration of the national state of disaster in response to COVID-19 are repealed, meaning done away with effect from midnight tonight.
Well, we're going to speak about this now with health expert Dr. Fundile Nyati, who joins us via Zoom to talk about the implications of what the president has just announced. Thank you so much for joining us. Now, I want to understand something. So the president says the national state of disaster, falls away, but he says that there are going to be transitional measures which will lapse after 30 days. So just down to non-pharmaceutical intervention or health protocols, what are we to understand on what comes into effect as of midnight tonight and what happens over the next couple of days, the 30 days that the president mentioned?
All right. Thank you very much. I think South Africans generally, since December, the past December, have generally been fatigued, by all the regulations, even though we're at level 1. And in the last few months, the opposition parties mainly have been, raising their voices around, this state of disaster. So what happened then today was, I would say a culmination of that pressure, on the government to say, you guys, there's no longer any reason for you to continue having this, national state of disaster. And so the president has then announced that as at 12 midnight tonight, all regulations, bar a few, will still be, will go away. And there will be only very few that will be remaining. For example, the wearing of masks indoors will remain, but there will be nothing expected of people to wear masks outside. Gatherings, there will still be some regulations that control that. That is the 50% capacity indoors, and outdoors. But in general, most of the regulations that impede social interaction and economic activity are going to be falling away tonight. So for me, that is great news, because certain industries, tourism, entertainment, and others, have really been hit hard by these regulations. And therefore, the announcement of the end of the state of disaster and its regulations, bar a few, is really something that should be welcomed by everybody. But he also emphasized the point then that these other transitional ones will continue for a period of 30 days. That is, the wearing of masks indoors, the ones on gatherings, they will continue for another, month or so, because there is still the public participation, or commentary process on the regulations under the National Health Act, because now they are going to use, the National Health Act. There's what we call notifiable diseases. So they are going to look at COVID-19 and other, diseases that are declared as notifiable diseases as a way to control, this problem. And so that is what we are then seeing. And at the end of 30 days, hopefully by that time, the new national regulations will have come to effect around about the 17th or so of April. And therefore, people can look forward to more, freedom to do what they are, they used to do before the pandemic. So those, limitations in terms of their rights as enshrined in the Constitution, they are going to, have them back. But on the other hand, people are going to now have to take responsibility to protect themselves and also to protect their loved ones. And so the, nanny kind of state, or the state where it's, people are being told what to do, is falling away. So it's up on all of us.
So, as you say, it falls away, and government has often given the rationale that the national state of disaster was to allow it to impose some of these health protocols. You spoke about fatigue earlier on. It certainly is showing a lot of people are not wearing masks. There is the fear of the fifth wave that will be upon us. So how are we going to ensure that people police themselves when people are very reluctant to do that, even indoors, not wearing masks?
Well, it's a situation where really they are basically saying, you guys, you now must take responsibility. We've done our part as the government. We've done what we believe was essential. But right now, if there's future waves, we will closely monitor. We may still bring back the national state of disaster if it's absolutely necessary. But in general, you are on your own. Take responsibility. And he also mentioned, obviously, that they came to this decision because of seeing the trends based on the fourth wave and the Omicron, where there were almost, less than half or about half of the deaths, the peak that was reached, also in terms of hospitalizations. So the hope here is that if there's any other future, variants, they will also continue on the trend that has got less impact on deaths, even if the numbers do go up. So I think they are playing that game of saying, we think because of the vaccination levels, because of the number of people who've already been infected directly, about 80% of South Africans combined, there shouldn't be a bigger risk to society. However, we'll closely monitor and hope for the best.
Well, thank you so much for speaking to us, Dr. Fundile Nyati. Much appreciated, health expert on the implications of the announcement made not so long ago by President Cyril Ramaphosa. In fact, it was announced 16 minutes ago. So basically, the president saying, although the pandemic is not over, and although we're continue to remain cautious, we can be confident that we are in a better position now than we have been at any other time over the last 750 days. The president saying that our greatest responsibility is to make sure that we are vaccinated against COVID-19 and to encourage others to get vaccinated. He also announced that there will be transitional measures which will lapse after 30 days, as you heard from Dr. Nyati there. That includes wearing masks indoors, and also on gatherings. The management of the pandemic has to be dealt with as appropriate by health regulations or other provisions, he says. So what this means is that in terms of outdoor and indoor venues, they can take up to 50% of their capacity without any maximum limit. What exactly that means, hopefully we'll find out in just a moment. As we speak now to Economist and CEO of Inkunzi Wealth Group, Owen Nkomo. Owen, a very good evening to you. Thank you so much for taking the time. So I'd like to hear your thoughts. Some people are cautiously optimistic about this. Some saying it's been a long time coming. There's been calls on government to lift the national state of disaster, saying that it is continuing to choke an already sluggish economy. What are your thoughts?
Yeah, I think it's certainly a very good move, good announcement from the president. We have been expecting it for a long time now. I think if you look at the trend in terms of the infection rates, in terms of the fatalities overnight, the rate has started to be quite accommodative for a change in the stance in terms of the National Disaster Act to moving into the National Health Act. We welcome the move by the president, and we hope that in the next 30 days, we will remember what life was like back in January 2020.
And that would mean, obviously, things like traveling, South Africans going abroad or outside the country and receiving visitors. But the president spoke about that, the need for proof of PCR tests and negative tests, etc. But how much is that likely to pick up soon? We're going towards the Easter holidays. Ordinarily, this is a time of travel, being with family. Are we likely to see an uptick in sales of accommodation or even traveling?
Look, I think that's a very big possibility, but it's possible for one to argue that people have been able to travel locally for a while now. I think what it does is it allows more people to travel outside the country. But then the challenge you have with that is you start to think about where you are going. Are the terms and conditions of travel the same as they are back here at home? But I think that one thing that's very important is South Africa has actually been a leading decision maker in the world in terms of some of these key decisions, and us moving into a position where in the next 30 days we could have a total lift of all the other peripheral rules that have governed the National State of Disaster Act. I believe that potentially we might see some other countries around the world also starting to follow suit, and I think it's a good thing. But the important thing is that people are going to be more free here at home. The conversation around wearing a mask when you're in the restaurant or indoors is now going to be a thing of the past. And I believe, like the president said when this thing started, he said that, we needed to take every step to make sure that we are protecting ourselves and protecting each other. I do believe that given where this pandemic is now, it's sort of settled. We've managed to deal with it. And I must congratulate the president for leading this major fight against COVID-19. And I'm hoping that the economy, travel starts to open up. I'm hoping that a whole lot of sectors that were punitively affected by some of these rules and regulation are now going to start having a little bit more uptick in economic activity. Because boy, do we need the economy to tick up so we can create jobs.
Which sectors in particular, Owen? And I want you to give us a snapshot of where we're from over the past couple of months, 2 years, just looking at joblessness, for instance, the income distribution. Obviously, a whole lot of families have not only lost breadwinners, but employment opportunities have also shut down as firms lay off people, and how we can rejuvenate the economy again. The president speaking about the COVID-19 vaccine injury no-fault compensation scheme, saying that that's going to continue as the national state of disaster ends. But I'm just trying to look at the support measures that government has tried to give people to help cushion the blow.
Yes, I mean, we had obviously the president talk about the 350 rands grant, the COVID grant continuing. I'm not sure I got the clarity as to whether it's going to continue after the 30 days cooling off period, or is a 30-day intervention measure. But it'll be interesting to see how the president deals with that one. But all sectors in the country, really, we need to make sure that the engines start pumping again. We need to see that the mining sector, which has been doing well, continues to actually do well, because all these tax revenues that we have achieved, 1.5 trillion rand, breaking records for this year, have been aided partly by the great performance of the mining sector. And as I've mentioned, tourism. We need manufacturing as well to come back to the fray. We need agriculture to get back to a level where it was before COVID, so that we can export more stuff. But all of these things, Thabiso, do not matter if our big trading partners are still on a different gear in terms of our COVID. As I saw recently in the papers, as late as yesterday, that China is now starting to also battle with COVID infections, now starting to go up. You don't know if they are going to go back to more stricter regulations. Europe also starting to sound a little bit iffy. I think that it's a great thing that here at home we are unveiling the blanket that's been covering this whole COVID challenge through people not having to wear masks, at least after 30 days. I think it's just going to give us a feel-good sense, a sense of freedom to be able to start living our lives without being overly washed by the regulatory environment. But we do hope that all the sectors will kick in, Thabiso. And the president did touch on the fact that as South Africa, we need to get back to the business of opening the economy, get back to the business of starting to create jobs, and get back to, obviously, the business of making sure that life becomes a semblance of what we knew before COVID attacked.
Okay, just a quick final question here, Owen. How do we, invigorate consumer spending in the current environment, both the internal and external shocks? I mean, inflation going up. I saw some very interesting figures saying that vehicle sales have gone up, and I'm asking myself, who is able to afford to buy a car? We're looking at a huge surge in fuel prices, even though government says it's looking at deregulating so that there'll be more competition. But how do we do that when the consumer is so hard pressed?
It is going to be difficult to get the full economy to get back on the saddle again. There are people that will still be left behind. The country will still need to support many of the unemployed people. And I think that to try and figure out how the government can pump in money into the economy to stimulate it, when the government actually fails dismally, in my humble opinion, to do that during the peak of COVID, I think it'll be disingenuous to expect that the government is going to do anything out of the norm to try and get the economy going. I hope at least that the fact that people are now free to get out there and do things, maybe they mentally and psychologically might have to start engineering themselves to think that the economy is open again. The national state of disaster has come to an end, and maybe they start to think about, getting back to creative ideas that might help the country start creating some jobs. But the government has a very big responsibility to try and find money to put out there into the economy for these jobs to be created. The government has a big role to make sure that they give small businesses access to funding so that we can be part of that ecosystem that is going to create these very much needed jobs after this terrible environment that we've just dealt with over the past 2 odd years. 739 days is a very long time. And I think that we need the government to act quite immediately in terms of releasing funds for small businesses and medium-sized businesses so that we can start creating those jobs that are very much needed in the economy.
Well, thank you so much for speaking to us and sharing your insights, Owen. Much appreciated. Owen Nkomo is the CEO of Inkunzi Wealth. So just speaking to us about how the government can re-inject some activity into our ailing economy. Now, this is also a very important time season as we head up towards the Easter holiday. The churches have been quite anxious to hear what the president is going to say in order for them to know if they'll be able to have what would have been pre-COVID numbers at the churches. The president, of course, is saying that the restrictions on gatherings remain, saying that 50% of indoor and outdoor venues will be allowed, and that is without any maximum limit. What that really means, I'm really not sure, but we'll hopefully find out when we speak to Reverend Fundile in just a moment. The president saying that this will be allowed provided a proof of vaccination or COVID-19 tests no older than 72 hours required to entrance for the venues. So